Good day, folks. Thank you for joining us here at Your Health. On today's program, we'll get you updated on new research on the health benefits of probiotics. These are healthy organisms that live in our intestinal tract, and we can supplement them in our diet, and they provide true health benefits. This is going to be a fascinating subject today, and I hope you stay tuned for that. But first, let's go to our news. Let's see what's happening in the health world. Low levels of vitamin D precede the development of type 1 diabetes in children. New research reported in Diabetologia and conducted in Germany evaluated vitamin D levels in 108 children with antibodies to their pancreas islet cells. This is a condition called prediabetes type 1. The researchers then compared these pre-diabetic children with 406 healthy children with no antibodies to their pancreas cells. They found the children who were in a pre-diabetic state had significantly lower levels of vitamin D in their bloodstream. The researchers conclude vitamin D deficiency precedes the initiation of type 1 diabetes. However, they also found if and when the disease progresses does not seem to be influenced by vitamin D levels. Related research reported in the Annals of Allergy, Asthma, and Immunology found higher doses of vitamin D help to calm chronic urticaria or hives. Researchers evaluated 38 patients who had hives for at least 5 years. All took a triple drug allergy protocol and all took vitamin D. However, half took 4,000 units, while the other half took only 600 units a day. They found after 1 week, all subjects showed a 33% improvement in symptoms, relief probably attributable to the drug therapy, but after 3 months, the group that took 4,000 units of vitamin D showed an additional 40% improvement in their symptoms. Well, folks, here we go again. More groundbreaking research on vitamin D. Vitamin D deficiency precedes the onset of type 1 diabetes in children. Now, you remember that type 1 diabetes, or insulin-dependent diabetes, most often occurs in children and young adults. Its origin stems from an autoimmune disease process that destroys the pancreas cells called islet cells. Those cells make insulin. The study from Germany finds that vitamin D deficiency occurs before the onset of the disease when antibodies to the pancreas are first detected. Now, this does not necessarily mean that vitamin D deficiency is the single root cause, but we do know for sure vitamin D deficiency plays a role. The reason I say that is because raising vitamin D levels at the pre-diabetic stage does not always prevent the development of full-blown type 1 diabetes. I know it gets complicated, but in any event, the American Academy of Pediatrics recommends all babies and children should take 400 units of vitamin D daily, while adolescents up to 18 should ingest 1,000 units daily. So be sure your kids, especially breastfed infants, are provided with extra D because breast milk is low in vitamin D. It provides everything else they need nutritionally, but not the D. Now, the second study is most fascinating. Higher intakes of vitamin D help chronic urticaria or hives. This means it is also possible that higher doses of vitamin D may help angioedema, a condition similar to hives. The omega-3 DHA may help children get a better night's sleep. Researchers from the University of Oxford enrolled 362 children, ages 7 to 9, who were all struggling to learn how to read. The parents of the children filled out a general health questionnaire. The researchers learned that 40% of the children suffered from regular sleep disturbances, such as resistance to bedtime, anxiety about sleep, and constant wakening during the night. Half the children were given 600 milligrams of DHA each day. The children's sleep was monitored during the 16-week study. They found the children that were given DHA showed a remarkable improvement in their sleep, with a 1-hour increase in sleep time each night and 7 fewer episodes of waking each night. The study was published in the Journal of Sleep Research. Well, folks, this one's an eye-opener. Giving DHA or fish oil to children who are struggling with sleep helps to increase sleep time by about an hour a night, while it leads to 7 fewer waking episodes per night. Folks, 4 out of 10 kids in this study had trouble with their sleep, and this discovery of this high rate actually surprised the researchers as it did me. Thinking back during my family practice days, it was common for mothers to express concern about the difficulty their grade school children had in falling asleep and staying asleep. We did not know at the time that a little fish oil or DHA would help, but now we do. This study selected children who are having trouble learning to read, and at this point in time, that part of the study has not been completed, but when it is, we will keep you up to date. Now, it stands to reason that fish oil will help reading because we know when kids get a good night's sleep, their school performance typically improves. We also have other fish oil related research I'd like for you to know. The University of Eastern Finland found that fish oil helps to increase large particle HDL levels. This is the type of HDL that protects from cardiovascular disease, and the study found eating 3 to 4 meals a week of fatty fish like salmon or rainbow trout, or supplementing your diet with higher amounts of fish oil, say 6 to 8 grams a day, will help to protect you from a heart attack. And that is good news. Today on Your Health, we'd like to discuss the health benefits of probiotics. These remarkable dietary bacteria actually help your body fight off disease. Stay tuned to learn more.
May savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Do you suffer from cramps, gas, bloating, or other digestive troubles? How about fatigue, depression, and headaches? All these symptoms could be caused by a condition called lactose intolerance. Your body doesn't digest lactose, the sugar found in milk and other dairy products. As a result, you can suffer from a wide variety of symptoms. If you often experience digestive problems, fatigue, depression, or headaches following meals, try avoiding dairy for a week or two and see if your symptoms lessen or go away. All of the nutrients found in dairy, including calcium, are present in sufficient amounts in other foods. So if you find that you are lactose intolerant, you can safely avoid dairy and still enjoy complete nutrition. For Your Health at a Glance, I'm Dr. Richard Becker.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. Welcome back, everyone. It is just such a blessing to be with you today. I hope everything is just wonderful wherever you are. Well, today's show is going to be quite interesting. We're going to be talking about the role of probiotics in good health. But to understand how and why you need probiotics, we have to understand what dysbiosis is. We see advertisements all the time for probiotics, don't we? Everywhere now. But do we really understand why we need them? So, Richard, dysbiosis is something that has been talked about for a few years, but I know that everyone knows now that probiotics somehow help your tummy, but they don't know why.
Yes, I think it's common knowledge now that there's a role of probiotics in our daily health. Well, we will take the probiotics to counter our intestinal dysbiosis. And what is dysbiosis? Let's try to understand that a little better. It is a condition of abnormal intestinal microbe growth, creating a toxic and even carcinogenic environment in the intestinal tract. You can have dysbiosis in your mouth, on your skin, respiratory tract, but the predominant location and the profound effects of dysbiosis of the intestinal tract has to be listed as number one. When we have this dysbiosis, it leads to disturbed digestion. It also leads to malabsorption of nutrients. It can cause inflammation of the intestine and distal organs. It's not just the intestinal tract, it affects the entire body. This in turn suppresses our immune function. It can cause hypervigilant immune function system. And what I mean by that is it can turn on the autoimmune process, creating an autoimmune disease like, I don't know, let's say rheumatoid arthritis. It can alter our cholesterol-based hormones, estrogen, testosterone, progesterone. It can actually alter these. It can alter mineral and electrolyte levels. It disturbs carbohydrate metabolism, as in diabetes. This has been well established now. Altered intestinal flora is a hallmark of diabetes. It can also alter the recycling of blood products and bile, which is when you do that, you alter your ability to detoxify pollutants and chemicals in our systems. So when this happens to us, when we have intestinal dysbiosis, what would be some of the signs? Well, you might experience recurrent colds and viral infections. You may experience the onset of allergies well into adulthood. It's common for children to develop allergies, and as maturation ensues, we lose that allergy potential, but then it comes back in the 30s, 40s, even 50s sometimes. This is a classic sign of dysbiosis. We may gain weight or we may lose weight. Actually, dysbiosis most common leads to weight gain, but it can go either way. There may be constipation, diarrhea, irritable bowel syndrome, food intolerances, food allergies, lactose intolerant. You have been able to digest milk and dairy products for decades. Now all of a sudden, not so good anymore. I can't have the milk or the yogurt anymore. There's a problem there. You may have fatigue, headaches, and chronic pain. This is very common. Dysbiosis is often accompanied by everything's inflamed. Everything hurts all of a sudden. You may have recurrent yeast infections, and the yeast and candida may be the major cause of the dysbiosis, but not always. Bacteria can do this as well. The autoimmune disease, metabolic syndrome, elevated blood glucose levels, blood pressure's up, and triglycerides. The doctor said, I'm concerned you may become diabetic if you don't lose a little weight. This is a classic sign of dysbiosis. And frankly, you may have a history of disease. You've been treated and intervened multiple times by physicians. This in turn can cause altered intestinal flora, and it may be a sign, a little clue in your history that your intestinal bacteria is off. Now, what causes intestinal dysbiosis? These causes are common. We encounter this every day in living in modern America. Malnourishment and poor eating habits. Do you eat a garden fresh diet every day? Very few people do. 80% of all Americans eat no raw foods. Raw foods ingestion is a major way we introduce healthy bacteria into our system. And most Americans, 4 out of 5, never eat those at all, never eat any salads at all. Most Americans are deficient in at least one nutrient, and millions are deficient in multiple nutrients. We have chlorinated and fluoridated water. Both of these agents affect our intestinal microbes. Pour yourself a glass of tap water, swallow it down quickly. We all do. We're in a hurry. That gets into our system. It affects our bowel flora. There's no doubt about it. We know it does. That chlorine is put there to keep septic contamination out of the water supply. But it's best to let your water glass sit for a minute and let the chlorine evaporate out. It diffuses out into the environment. But we rarely do that, do we? Obesity. University of Texas showed that obesity causes altered bowel flora. As you gain weight, your intestinal microbes change. Their profile, their character changes. If you become a diabetic, it changes again. And the dysbiosis of diabetes is not the same as the dysbiosis of weight gain. They are different and have their own unique characteristics. You may have a history of non-alcoholic fatty liver disease. Up to 20-30% of all people who have gained a little weight, 30-40 pounds, they also gain fat deposits in their liver. It's a prelude to diabetes. It causes inflammation, and it is a classic sign of intestinal dysbiosis. fatty infiltration of the liver. This in turn leads to leaky gut syndrome. This has been proven in multiple good studies. Antibiotics, have you ever used antibiotics? Who hasn't in the modern world? A study done at the University of Michigan showed one course of antibiotics in the subjects, their bowel flora did not return to normal after 11 months of following. It never did. The whole course of the study, it never did return to normal. We can correct it, but it didn't unless you do something about it. We'll talk a little bit more about the antibiotics in a second. What else can lead to this dysbiosis? These are common things, probably in your history. Have you been taking any pain medicines, anything that constipates, like a narcotic pain medicine? How about anti-inflammatory medicines? It affects the prostaglandins in the intestinal function, and this leads to altered bowel flora. Hormone replacement therapy of any type, oral birth control pills. Any hormonal therapies have the potential to alter our bowel flora. Steroids, prednisone, allergy sprays for the nose of the steroid type. Stress. Ohio State University was able to prove that Clostridia, this is some bad stuff, the Clostridia class. It can cause gas gangrene, it can cause tetanus, that family of germs. When you have stress, the Clostridia increase in your intestinal tract. Aging. Aging seniors have dramatically lower levels of normal intestinal flora. Part of it is due to the aging process. Part of it is due to the challenges that aging brings, like poor dentation, having trouble chewing. You can't chew raw foods anymore. I've lost my appetite. I'm taking multiple medicines. So it's not just aging, it's the challenges of aging, dramatic effect on the intestinal tract. Travel, exposure to new infectious disease. Within 24 hours, you can be anywhere on this planet. Isn't that amazing? We've never had that ability short of the jet age. This means you can be exposed to germs at record time, and you don't even have to leave your town because other people are doing the traveling for you, bringing the germs to you. How about Ebola? You heard of that one? How did it get here? Through a jet. So this travel has changed everything in infectious disease. So exposure to germs is just, it's inevitable in the modern world. If you're around people, you're going to be exposed to exotic germs. Weakened immune systems, all the things, medicines and whatnot, it allows the flora to flourish. All of these things contribute to altered bowel flora. But perhaps the most profound effect is that of antibiotics. Now let me tell you, let me give you an idea of how profound antibiotics can affect our bowel flora. The University of British Columbia analyzed the chemical composition of mice feces. Then they found and assessed the amount of over 2,000 different fecal chemical elements. Then they gave the mice one round of antibiotics. Okay, you got the scenario, mice, analyze fecal chemicals, give these mice a round of antibiotics, reanalyze those same chemicals. They found the levels of 1,750, that's 88% of those chemical analysis changed. And they increased or decreased anywhere from 2-fold to 10,000-fold. The most affected systems were the hormonal systems, the inflammatory systems, the carbohydrate and fat metabolism, along with bile production and recycling of blood components. Profound effect. And as the University of Michigan found, you take a round of antibiotics, it can be years before it corrects, if it ever corrects at all. We have to do something. The University of Maryland also found that probiotics facilitate the actions of other intestinal bacteria. So when we take the probiotic, it orchestrates the return to normal function of the bowel flora. Do any of these things exist in your past history? Is it possible that your current state of affairs stuck in poor health? Is it possible? It's not possible. It's probable that intestinal dysbiosis is playing a role. Now we're going to a break, but we have some new science on probiotics to help you fix this problem when we return.
Savings time is here again with our annual Cancer-Free Celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. I'm Cindy Becker, and this is Your Health at a Glance. The next time you're buying meat, look for low-fat, uncured, unprocessed meat in its natural state. Why? A low-fat natural meat diet could be the healthiest of all. Research from Harvard University compared processed meat diets with natural meat diets. The extensive study involved more than 1 million people in 10 countries. The scientists discovered a diet of processed meat that contains preservatives and nitrate-curing agents, such as bacon, sausage, and deli meats, increased the risk of heart disease by 42% and diabetes by 19%. They also found natural meats, free of these curing and preserving agents, did not raise the risk of heart disease or diabetes at all. So shop for lean, uncured meats free of additives and in their natural state. For Your Health at a Glance, I'm Cindy Becker.
Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. We're back, everyone, talking about the role of probiotics in good health. And wasn't that interesting to learn all about dysbiosis? And I've got to say, and Richard will agree with me, there is a time and place for antibiotics. Antibiotics absolutely save lives. And sometimes when you get an infection, that is what you have to do. But you have to just take the next step. Recolonize your intestinal tract. You can get yourself back in order. You really can. You just have to work at it.
Yep.
So, Richard, I'm really excited that you have some new stories, some new research on probiotics and their role in good intestinal health.
Yeah, it's really fascinating, the state of the science today. Honey, do you remember the first time we did this program, there were 35 research articles at PubMed. Just 35. There are 14,000 now at PubMed and 1,000 double-blind. There were no double-blind studies at all. There are some 135,000 at Google Scholar, you know, the worldwide library. The PubMed is those who get U.S. government help and funding and whatnot. So U.S. government-funded studies have dramatically increased, 14,000. The first conclusion, the state of science today is that they've done a lot of review studies now where they look at the total body of evidence for probiotics in certain disease conditions, and they're able to make conclusions so that we no longer need to cite the reference, and we're working our way towards standard of care. This is a major step in the process of every doctor in America being expected to tell their patients about probiotics. We're getting so close to that the doctors who are really on the edge of the cutting science and really know what's going on, they've been doing it for years. But soon it'll be malpractice not to tell people. And I can't wait for that day because it will relieve a lot of suffering. Our first conclusion that we've learned from the state of the science as it is today is that multiple strain probiotics tend to work better for health conditions. There are many single strain probiotics, and those are okay for certain conditions. But if you want it for broad health, for multiple health conditions, the multiple strain probiotics tend to work best. That's the first conclusion. Next, Cochrane Review This is from 2015, not that long ago. 11 studies. They examined the entire world literature, and that's how we will preface every one of these till we change our subject here. 11 studies determined probiotics decrease the frequency and duration of upper respiratory infections. How many times have your child or you missed work because of a bad cold? You're miserable, and it really affects your paycheck. Well, the worldwide literature has determined if you take probiotics on a regular basis, you're going to have fewer of these upper respiratory infections. They're going to be less severe, and they won't last as long. That's worth doing. Next, best practice in research clinical gastroenterology. 2016, probiotics reduce the duration of acute gastroenteritis, intestinal flu bugs, food poisoning, this type of thing. And they also reduce hospital length of stay should that be required. They also reduce the occurrence, but they say we need more study on it to be able to say you will get these less often in your life. But we do know you will have fewer episodes of food poisoning and flu bugs, reducing the hospital length of stay, duration, and severity. That will decrease. Next, World Journal of Clinical Cases. The elderly have altered intestinal flora associated with aging and with other health conditions and treatments. The two arms of elderly dysbiosis. The use of probiotics, from reviewing the worldwide literature, helps to correct intestinal dysbiosis in the elderly, reducing diarrhea, reducing prescription medicine side effects, and improving regularity, decreasing constipation. The overall effect is an improved quality of life. These are not my words. These are the researchers who reviewed all the available research worldwide. This is impressive. Are you in that scenario? Altered intestinal function, more constipation, you're not digesting as well, you're up in years, you're on several medicines, and you know your diet's changed, you can't chew so well. You know the drill. You've lived it. Getting old is not for sissies, as Grandpa used to say, but probiotics will help improve your quality of life. This is worth doing, folks. Next, the medical journal called Gut. 11 clinical trials show probiotics reduce antibiotic-associated diarrhea in older patients. Now, this is one of the more common questions we get. I have to take an antibiotic, and I want to take advantage of the probiotics benefit, but I don't know if I should do that while I'm taking the antibiotic. Won't the antibiotic kill off the probiotics? No point in taking it, right? I've heard that so many times. All of these studies gave the probiotic with the antibiotic, at least during the same day. I would not take it at the same moment. I would split it up throughout the day. But take your probiotics whenever you're on the antibiotic. This study proved it's still effective. Part of the reason is even dead probiotics provide health benefits. That's something that was established many years ago. But you see, you can't really sterilize the intestinal tract with an antibiotic. So you're not really killing off all the probiotics, especially if you gap the dose. Take your antibiotic first thing in the morning, take your probiotic at noon. See, then you're not having that competition. So, less trouble with antibiotics if you take a probiotic with it. World Journal of Gastroenterology, 15 clinical trials reveal probiotics reduce the pain and severity of irritable bowel syndrome. 20% of all Americans have IBS, this irritable bowel syndrome. 20%, that's 60 million plus people in America. There's no drug that really works very well. Oh, they sell drugs. Oh, they do. But they don't work that well, and several of them have been taken off the market due to severe side effects, death, including death. Probiotics, the result of 15 studies, and they started with many, like 40-some studies, and narrowed it down to the absolute best studies, the highest statistical methods, the best reliable results you can find. IBS, reduce your pain and severity with probiotics. Multi-strain works the best, remember that. Here's one that's very important. Stay with me on this. This is Pediatric Drugs, that's the journal. June 2015, a review of all the available research on the use of probiotics in pediatric population. That's our children. You know, folks, the children are the only innocent ones among us. We need to take better care of them. This is part of the plan. Probiotics in children improves outcomes in prevention and treatment of acute infectious diarrhea. Less infectious diarrhea in children. Prevention of hospital-acquired diarrhea. Less hospital-acquired diarrhea, less antibiotic-induced diarrhea, useful in prevention of traveler's diarrhea in children, prevention and treatment of infant colic in pediatric. Infant colic, boy, do I remember those days. Do you? That's hard. Your babies will have less colic if you give them probiotics. Prevention of necrotizing enterocolitis. This is a severe life-threatening condition to preterm infants. We don't have time to go into it all, but probiotics help those outcomes. Induction and maintenance and remission of ulcerative colitis and improved IBS. They also found in this study which probiotic agents work best in these conditions for kids, little babies. And I must say, I don't do this very often, but Cindy, the probiotic that we developed for babies hits every single one of those. We have the right organisms for every single one of those conditions. It's a chewable, it can be crushed and put in food for little ones who can't be trusted with a little pill. But isn't this amazing? There is help for the babies with probiotics, and they found they're safe. So let's go to our break, and we have more in just a minute.
Savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Cindy Becker for Your Health at a Glance. Do you like to exercise outdoors? Many consider gardening one of life's most rewarding activities. The American Heart Association says gardening promotes a strong heart, and it helps to preserve brain mass in seniors. Follow these guidelines so your gardening experience will be enjoyable for years to come. Wear a wide-brimmed hat and protect your skin from too much sun. Wear gloves and sunglasses even on cloudy days. Make your posture strong by bending from the knees. Consider wearing knee pads. Start with small jobs. Set a gentle pace and ask for help when moving heavy objects. Pause frequently and drink lots of water. Whether it's trimming bushes, cutting grass, or growing nutritious vegetables, gardening is a great way to get your exercise and get back to the earth. For Your Health at a Glance, I'm Cindy Becker. Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
We're back, everyone, having a great discussion on probiotics, and isn't this research just amazing? Well, before we continue, I've got to let you know about the May Savings Celebration at BioInnovations. A great time to get the best products, best prices of the year, and free shipping on orders over $50. Of course, that's in the mainland USA, but I don't want you to miss out on that. So, Richard, you have another study that's on the little ones.
Yes, you know, upper respiratory infections, it's the #1 reason why kids miss school. And when the kid misses school, mom tends to miss work and on, and there's a cascade of events. And so even preventing one upper respiratory year infection in kids That's worth doing, especially with all these other benefits for kids and adults. Probiotics decrease the occurrence of childhood upper respiratory infections. Now, let's not just stop with a little probiotic for the kids. Give them the probiotics, give them their vitamin D. After infancy, we can go up to 1,000 international units. And then a good chewable multiple vitamin, so they get their B vitamins. That's a good idea. A little extra zinc. You can get these in chewable minerals. And, you know, if the child is too small to be trusted with a tablet or a chewable, you know, under 2, under 3, they may choke. We don't want that to happen. Take and crush those, the supplement, and mix it in with a little applesauce or yogurt. That's a good way to do it. And then you're really boosting them up and giving them the nutrients they need to fight off all these infectious agents. Now let's keep going. There's so much more. Population nutrition, 12 studies reviewed, include probiotic administration to children improves growth and development, especially in underdeveloped countries where resources are scarce. This is where it had the biggest effect, but all children. Isn't this fascinating? Growth and development. We don't think of probiotic as a nutrient that supports growth, but its effect on all these body systems, yeah, when you think of it that way, for optimal growth and development of a child, they need these probiotics. Make it a part of their routine. Here, let's go out of pediatric into the rest of us, rhinology and allergy. Adult use of probiotics for allergies improves nasal symptoms and quality of life scores. Worth doing. Those allergies can really be, you know, it ends in sinus infection, then you get antibiotics, then you're dysbiotic, and then you need more antibiotics, and before you know it, you're in chronic fatigue and chronic pain. And it all started with allergies and dysbiosis. Let's do something about that. Current opinion in support of palliative care, lactobacillus probiotic, review of all the available information when given in sufficient quantities in prevention reduces the side effects of chemo and radiation therapy for cancer. Did you get that? In sufficient quantities in prevention, probiotics reduces the side effects of chemotherapy and radiation care for cancer. Now don't just stop with the probiotics. Give the probiotics. How about some beta-glucan or medicinal mushrooms? It helps with the radiation side effects. Grapeseed extract, resveratrol, a powerful antioxidant. Curcumin, a little vitamin C and CoQ10 to protect the heart. Milk thistle, olive leaf, these powerful antioxidants. You're going to come out of this radiation and chemotherapy in better shape. It works best in prevention. So many times people call us and say, well, I went through the radiation and it was over 3 months ago and I'm miserable. I can't swallow. I have all these problems. I have constant diarrhea. And I say, well, this will help some now, but it would have worked great if you'd done it during the therapy. If you have anyone that you care about headed for radiation or chemotherapy, convince them that being proactive and acting in prevention with these agents, you're going to spare them a lot of suffering. And you may even save their life, because far too often therapies for cancers are stopped because the side effects are so severe. You want that list again now that you have a better background on it? How about that? Probiotics, either beta-glucan or the medicinal mushrooms. Grapeseed extract with resveratrol, curcumin, powerful antioxidants, vitamin C and CoQ10 for the heart and the brain, milk thistle, olive leaf, this type of thing. Rotate through those, you're going to make a difference. Use them all together. Fill the intestinal tract with probiotics. The night before, eat a bunch of yogurt, then go in and have your stuff done. It makes a difference. Let's keep going. Diabetes, metabolism research and reviews. 33 studies now show that 33, that's a lot. Millions and millions of research. Don't ignore this expensive research, please. 33 studies show probiotic use in diabetes improves fasting blood glucose levels, postprandial glucose, that's after you eat, your sugars stay down better, hemoglobin A1C, your long-term 3-month average glucose, insulin levels improve, insulin resistance improves, blood lipid levels, you know, your cholesterol and triglycerides, and your inflammatory profile improves, and your antioxidant capacity. This is one of the new things they're finding. Probiotics are antioxidants. Isn't that amazing? Diabetics, pay attention. You have a unique set of dysbiosis, and probiotics are really, they're necessary now. We just know too much about it in diabetes. You need that. Journal of Nutrition and Food Science. About half of the studies they examined, 3 of 7, conducted shows probiotics helps to reduce obesity. I think when it's all said and done, it'll be very clear that it does. Yeah, we don't have time to go into it, but that's my opinion. But currently, about half the studies say, yes, it reduces obesity, half say it doesn't. Next, Food and Nutrition, 2016, Review of World Literature. Probiotics reduce cardiovascular disease risk. Who would have thought intestinal bacteria affect your heart attack risk? Who would have thought that? And it does so by reducing cholesterol. It reduces blood pressure levels. Your BMI or your obesity level, they found it did in this series of reviews. Your diabetes potential, your LDL cholesterol, your LDL to HDL ratio improves, and your blood glucose levels, all those improve. So when that happens, we know your chance of a heart attack and stroke is going to drop. Isn't that good news? And we did it with probiotics and a little yogurt. Who knew? I guess Metchnikoff knew. The original man who said this in 1908, he won a Nobel Prize for this, a Russian scientist. What a brilliant man. The foresight, the training. Maybe he had a God moment too, you know? It was put in his head for a reason. Let's do this. Let's go to our, I don't want to rush through any of these because the next one may be your condition and you need to know it. So let's go to our break and we'll come back. We'll have more. For thousands of years, Eastern health practitioners have used mushrooms for a variety of treatments.
And recently, scientists everywhere in the world have turned to mushrooms in search of health-promoting compounds.
These are known as medicinal mushrooms. Among some of the most potent are ABM, maitake, reishi, shiitake, and cordyceps sinensis.
At BioInnovations, we've made available 4 of the most powerful mushrooms in one easy-to-use formula. We call it the Mushroom Complex. We also offer the amazing mushroom Cordyceps sinensis in a standalone formula.
Cordyceps helps boost energy, an amazing discovery now used in both Eastern and Western medicine. So take advantage of thousands of years of health knowledge.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. Here is our hope for you today. I'm Cindy Becker. In the epic movie Gone with the Wind, Scarlett O'Hara says she won't think about her problems today or she'll go crazy. She'll think about them tomorrow. How should we think about tomorrow in our lives? In Matthew 6, verse 33, we get advice about tomorrow. Seek first his kingdom and his righteousness, and all these things will be given to you as well. Therefore, do not worry about tomorrow, for tomorrow will worry about itself. It's so difficult to not worry about the future. Many of us catastrophize about the future. That's spending all your time thinking about all the catastrophes that might happen. So let tomorrow worry about itself. That way, we won't miss the wonderful things happening in our lives right now. I'm Cindy Becker. This is our hope for you today.
May savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. We're
we're back, everyone, talking about probiotics and their role in good health. Well, first, I've got to give you another reminder about our May Savings Celebration at Bioinnovations. Great celebration we're having, and really, really good prices, best prices of the season, and free shipping on orders over $50 in the mainland USA, so don't miss out. Order early. Well, Richard, you have a study to share now that's quite interesting.
Yes.
The effect of probiotics in dental health.
Yes, Quintessence International did a review of all the data available on probiotics and dental health, and they found that they reduce the occurrence of biofilm production. You know, a biofilm is a substance, it's like a shellac or a varnish that infectious bacteria secrete on, say, a tooth, and antibiotics do not penetrate that. And so they found if you include probiotics in your diet and in your supplement plan, it helps to prevent the emergence of these biofilms. Now, you can get a biofilm in other areas. Say you have a prosthetic device, you had a hip replacement surgery, and it becomes infected. Those bacteria will make a biofilm on that metal hardware in your hip, and it protects the bacteria from the antibiotic. Now, it's my opinion, but I think oral probiotics would help the biofilms in prosthetics no matter where they are, in the mouth, anywhere. That's my opinion, but I think it's true, and I've been studying this for years, and why not? You get all kinds of benefits from the probiotics anyway. Why not take them after and before operations? Well, here we go. Journal of Hospital, let's see, here we go. Clinical Gastroenterology and Hepatology. A review of all the available information, both prebiotics and probiotics, when given prior to liver transplant, reduce post-operative infection rates. They did it specifically on liver. You know, the liver transplant patient is stressed with poor immune function, because when the liver fails, your immune system is failing too. So, fewer post-operative infections. Journal of Hospital Infection, next one, 20 clinical, surgeons pay attention. 20 clinical trials reveal when probiotics are given prior to surgery, they reduce the occurrence of surgical site infections and urinary tract infections more effectively than the placebo and more effectively than antibiotics. Antibiotic administration is standard of care, but if you switch over to probiotics, you get better results. Why not do both? There's a place for both. And I'm sure they've studied that, but that's not what this review was about. It worked better than the placebo, and it worked better than the standard of care antibiotics. Probiotics prevent surgical site infections and post-op urinary tract infections. This is one of the leading causes of comorbidity and mortality in the hospital setting, is post-op infections. Millions, probably billions are spent every year on prevention. Probiotics work, folks. If you're going in for a surgery, the week before, every day load your body with yogurt, buttermilk, kefir, sour cream, and take your probiotics every day so your intestinal tract is just full of these beneficial organisms. Your surgeon may not know this research, but you do. And when you know, the burden's on you. You're not going to hurt anything. They found it was perfectly safe to do this. Isn't this wonderful news? Well, if you'd been around a post-op surgical wound infection, you'd say it's wonderful news. I've been there. It's no fun. It's tough. And these germs are getting harder and harder to treat. You know about that. That's in the news. Let's keep going. You know the H. pylori, the infection of the stomach, how it leads to ulcers and even stomach cancer. They have found that outcomes improve by a review of all the world literature. Outcomes improve if you add probiotics to your double, triple, and quadruple therapy now for H. pylori. Antibiotics. There are 1.5 million cases of Clostridia difficile, 29,000 deaths, and 83,000 recurrent cases in the U.S. every year. 1.5 million cases and 30,000 deaths from pseudomembranous colitis, a direct result of antibiotic use. And 1/3 of all antibiotic-associated diarrheas are due to C. difficile. They didn't realize that it was so common. They found 21 trials, all the world literature shows probiotics reduce this risk. Whenever you take an antibiotic, take a probiotic. And this again, all these studies were probiotic with the antibiotic same day. Just separate them a little bit so they don't in direct conflict. Better outcomes. Beneficial microbes. 13 studies reveal probiotics may improve CD4 counts in HIV patients. What is CD4? It is a glycoprotein, meaning a carbohydrate attached to a protein that are on the surface of white blood cells. And what these CD4 cells are, they're conductors of the immune system. They coordinate the immune response. You may need more of this type of white blood cell. Whatever it is, it coordinates that. And when you take a probiotic, HIV patient, you get a higher CD4 count, which means your immune system is more coordinated and more likely to be able to fight off an infection. And that is good news for the HIV patient. Here's one that's important. Animal, this is the scientific journal called Animal. Yeah. They found the use of probiotics in the place of antibiotics in the feedlot animals, in their food, provides major but incomplete benefits. So it's helpful to feed the animals in our feedlots that make the food that feeds America, because we're trying to get the antibiotics out, because we know without a doubt the antibiotic-associated resistance is directly linked back to the feedlot use of antibiotics. Some 30,000 tons. 30,000 tons of antibiotics are fed animals every year. And this of course, trickles down to us. And they found if we just replaced it all with probiotics, there'd be major benefits, but not quite enough. So they need more research, but it's part of the answer to reduce our antibiotic resistance. Isn't that amazing? It is. Let's go to our break, and we have a few unique and unusual benefits from probiotics that are just in right off the press. So we'll be right back with that.
Savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker, and this is Your Health at a Glance. If you have an irresistible urge to move when you're falling asleep, you may have restless leg syndrome. This is a puzzling but common condition. It causes you to feel odd sensations relieved only by moving your legs. You wake up often and usually suffer from insomnia. Different medical conditions cause restless leg syndrome, such as iron deficiency, magnesium deficiency, varicose veins, pregnancy, fibromyalgia, peripheral neuropathy, Parkinson's disease, or a side effect of taking antidepressants or antihistamines. Supplementing your diet with vitamins C, E, D, and magnesium may be helpful. If you are iron deficient, take iron only if a doctor tells you to do so. If you can correct the underlying cause, you can quiet your legs and sleep through the night. For Your Health at a Glance, I'm Dr. Richard Becker.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. Your Health is brought to you by BioInnovations, trusted products for your health and well-being. We're back, everyone. Just a really quick reminder. It is May Savings Celebration at BioInnovations. Great prices. Call for details, but I don't want you to miss it. So, Richard, time is short, but you have some new studies to share that we can't miss.
Yes, they're always the unique things that probiotics help, and let's go through those quickly. Those who take probiotics have less social anxiety. Isn't that amazing? Less social anxiety. Probiotics reduce heavy metal levels in children and pregnant mothers. Amazing. Probiotics reduce complications after colorectal surgery. Less ICU, ventilation support, mechanical breathing for the less of that. That's always a good thing. Fewer infections, fewer leakages in the connecting of body parts back together. Probiotics facilitate other intestinal bacteria. It's the conductor of the whole system. They don't come in and overgrow and take over everything. They tell everybody else what to do. That's how they work. See, that's a real breakthrough in understanding how these agents help us. Probiotics reduce the candida overgrowth. That's really not news. Every practitioner that uses probiotics knows that, but they've been able to prove it. But this one was in intensive care preterm infants, very susceptible babies, very susceptible. Probiotics modulate the immune system. Again, the conductor. Probiotics improve rheumatic arthritis, rheumatoid arthritis, improves outcomes there. Critically ill patients do better. ICU patients do better with probiotics, and they're safe in the intensive care. You can give yogurt in the intensive care. It's okay. Probiotics reduce the risk of colds in physically active, healthy adults. Elite athletes, pay attention. Reduce colds. Probiotics improve the likelihood of sustained remission of diverticulitis. That's a very painful condition. You want to keep it away, stay away. Probiotics reduce a whole wide variety of measures of systemic inflammation. Multi-species probiotics work best, especially in IBS. Probiotics improve the health and the appearance of dry skin. Here's one. Probiotics improve vitamin D serum levels by about 15 nanograms per deciliter points. That's good to know. Who would ever thought it would interact? But it does. Vitamin D improves your blood levels, probiotics improve your blood levels of vitamin D. Probiotics improve chronic functional constipation in children and in adults. And probiotics, when given to overweight kids, reduce BMI, waist circumference, waist-hip ratio, triglycerides, and total LDL levels. Kids are healthier when they get some probiotics in their daily. And here's the thing. The multiple strains really are the best because you want help with all these things. You don't know what the future's going to hold. I want to prevent these things. That's our first and foremost goal. So multi-strain probiotics, we have that both for the adult in the swallowed tablet type and also in the chewable for the kids. And again, if the child's under 3 or they have any trouble with swallowing pills, just crush it up, mix it with a little yogurt, applesauce, whatever. And I do want to make the point, it's not just about taking a probiotic. It's about finding a low-sugar probiotic dairy that you digest and tolerate well, and then changing it up, because most of the commercial fermented dairy is a one-strain system. One strain of probiotic, and you want that multi-strain. There will always be a place for the dietary supplement probiotic because of that multi-strain effect. Because you want that benefit. It's just so tremendous. You know, when you get the right probiotic, you take in, you go, oh, yeah, that feels better. I get what they mean. Everything is clear. I don't feel inflamed. The tummy's right. I'm ready to go. And when you get it right, that's what happens. That's the benefit I want you to experience. And you get that with probiotics. So I know they've made a tremendous difference in my life. I really wouldn't be here today after cancer and all I went through. I wouldn't be here with the right probiotics. So thank you for your kind attention here on Probiotic Day. A lot of information, but it's designed to help you get well. We'll see you tomorrow, folks. Bye-bye.
Thanks, everyone. We'll see you tomorrow right here on Your Health.
In watching Dr. Stanley all these years, he's still speaking the truth about hearing the voice of God and obedience. There's nothing added to it. There's nothing that he's taken away. It's just truthful. And then it's Dr. Stanley, and he is an amazing communicator. There's just no nonsense there, and that's what I love about him. You know, he's very honest about who God is and truthful, and that's essential in the world that we live in today.
Who is Mom? Mom knows the art of playing games. She can open things. She has the ability to translate 2-year-old talk.